So welcome, Dr. Kyle. Let me kick off this session with a broader question for you. During this pandemic, there is a huge opportunity to monetize data like never before, to kind of predict a lot of business models and business performance. There's a huge opportunity to provide actionable intelligence and steps, especially around areas like fitness, healthcare, performance, to help people around the world. Could you talk a little bit about some of your initiatives, especially around data and data sciences that you are driving at FMS?
Sure. Thank you for having me. It's a pleasure to be here. And just a little bit about, I guess, my background and how we look at it from a data perspective. We spent the last 15, almost 20 years looking at research to help identify individuals at the greatest risk for particular injuries. And we've done that in multiple settings: professional sports, large studies in the military. And from an old-fashioned research perspective, we would use linear regression and logistic regression models to identify the variables or the attributes that were most commonly related to injury. So coming from that background as a researcher and understanding that process, as the whole concept of using data within your business has grown, I have always had a natural affinity to that because I understand the value and the strength of logistic regression, which is probably a very simple way to look at things compared to the way supercomputing and high-end data analytics can do it today. So I've been very excited since the beginning looking at things, because what we've learned, and if I have anything to share, it's probably this: what we've learned is looking at multiple factors together, certain combination of factors that exist within a person, is the key to determining what they need to do next, whether it's rehabilitation, injury prevention, health, wellness, fitness. It's multiple factors that can be easily gleaned from questionnaires they fill out and then physical tests that we perform.
All right, some fantastic perspectives there, Dr. Kyle. As an extension to that, and as a segue to the earlier question, increasingly the world is moving towards virtualization and shift towards an online experience, more so in the post-COVID scenario. How do you see data playing a key role in providing more personalized, kind of services and at your company courses in terms of assessment and next best offerings?
Yeah, another great question. I think when we look at it from a perspective, and I'll shift a little bit here. Of course, at FMS, we train thousands of personal trainers, physical therapists, chiropractors around the world. And as COVID hit and things shifted, we had to change the way we do our training, or a portion of our training, to what we call virtual training. So we have a robust online experience where the user can go in and watch well done pre-canned videos and have a good experience, but that just doesn't, it still doesn't replace that somewhat live interaction. So as we have shifted toward virtual courses where we're in the studio, we've got multiple cameras, and I'm going through, as the instructor, I would be going through the same thing I would do in a live course, getting the feedback from people and how people have responded. That would be our customers, meaning the actual physical therapists, chiropractors, personal trainers, how they've responded, how they've interacted, and what are the tools that can help enrich that experience, has been incredible. So we're already thinking of ways to do that, looking at their responses and how they ask questions and want more. So one, we were really surprised at how valuable the virtual experience has been for our customers, and then to build on that, to use more sophisticated algorithms to help figure out what each customer needs, is something that we would really embrace and feel could really help move our business forward.
Thanks, Dr. Kyle. Some great insights there for us. My next question is on the popular topic of of customer experience. CX has been or has become the top priority post-pandemic for most of the companies. Given FMS's direction towards accelerating some of the digital initiatives that you talked about, can you talk a little bit about what your strategies are around how you prioritize and accelerate some of these CX initiatives while ensuring that the target outcomes are met like we discussed earlier?
Yeah, another great question. I think from this perspective, I'll think about it more from the end user, so the consumer that's out there utilizing the tools that we develop and that we train our customers to use. So the B2B piece is one thing, but what's it like for the consumer at their end? And I think what's number one is people are used to using their phone, they're used to using apps, most people are. And the way we use smart technology to individualize the questions that are asked, the tests that the person gets, the exercise interventions, the recommendations for health and wellness and lifestyle changes, behind the scenes, the data and algorithms can help individualize that so much, right? So like, here's just a really simple example. You go to the doctor's office, and still today, most places, they hand you a hard copy questionnaire, right? And they'll ask you to fill out these questions, like, well, questions with the demographics, your name, your address. And it's like, I come here once a year, nothing's changed. So why don't you have that information? And then they'll ask you questions that don't apply to you at all. Like, I mean, I just get frustrated when they ask me if I'm pregnant. I'm not pregnant, right? I'm sure of that. So that's a very simple example. So when we're working behind the scenes to specialize and to individualize the questions and then the tests, some people don't need every physical test that we would do. Some people need more than others, and we can do that behind the scenes. So the experience for the user is very streamlined, very individualized, and they don't even know. They go through it and they don't know all the things that the behind the scenes, the data and the algorithms we're picking for them, because it's exactly what they need. Then they get a very individualized program at the other end, rather than everybody getting the same exercises or the same diet recommendations. You're going to get ones that are tailored to you. So we see that as a major benefit for the user experience that is very much tailored to their needs. So a great example of this at FMS, the way we utilize the technology is through our consumer-facing app we call MovePrint. What we do at MovePrint is we have really has brought together everything we learned from injury risk and prediction, as well as individual behaviors, the importance of nutrition, the importance of sleep, the importance of mood and behavioral health. And we put all that into one application, and that application then seamlessly takes the client through an experience. And the experience is a few questions, and if they're doing okay, we go right to some tests. If they pass one test, they'll get another test. And ultimately at the end, it puts them in, through the algorithm process, puts them in one of 4 fitness or wellness type categories. Some people are doing great. They can keep working out, keep doing the workouts that they're doing, maybe do more workouts, maybe go get some higher end testing for performance, where other people probably need to see a healthcare provider. So when we are able to weed through what that person needs, anywhere from a healthcare referral all the way up to fitness, it really streamlines things. So we found that to be extremely useful in terms of the user end, using the algorithms behind the scene, and then connecting providers to the client. So if a client hits and they need a certain type of provider, well, we'll find the best one in their area, and behind the scenes we can get them connected. So there's a lot of value for the client, obviously, is first, and then making those referrals and connections would be next. COVID has pushed things to the virtual world, and there's been so many positives. I'm kind of a glass half full guy. Folks at SuneraTech have been super in terms of helping us recognize, as we said, in the big picture, how does data come together? But when we look at educational environments that we work in, how can we leverage this virtual experience and figure out how much can we deliver virtually that we didn't used to in the past? And then how do we work behind the scenes to figure out what each one of those clients actually needs? And some will need some hands-on work and others do fine virtually. So going forward in terms of behind the scenes, figuring out which folks we're going to invite to hands-on training where other ones wouldn't have to actually be there. So the virtual environment being pushed to it has taught us a lot, and behind the scenes with technology is a crucial piece so we don't lose that true interaction, and we can confirm that actual learning and behavioral change has occurred.